Imagine that you're in a heated argument with your significant other. You become very upset and furious. You begin throwing dishes, houseplants, and books. Whatever is in your reach, you throw across the room out of anger. The dozens of roses in the vase that was sent to her flies across the room. At that point, you would most likely say that your blood pressure has gone through the roof. Well, it's true. Stressful events do temporarily increase blood pressure. And it's normal, and usually there's nothing to worry about. But when you have hypertension, your pressure is consistently high, even when you're at rest. Hypertension is a risk factor for a variety of medical conditions, and if untreated, could possibly lead to death. Because hypertension has no symptoms or warning signs, it can be so dangerous to your health and well-being, Dr. Randall Zuzmanet from the Medical Harvard School agrees that it has earned the nickname the silent killer. Hypertension, it's a very serious thing. And even though there are many risk factors that contribute to hypertension, it can be monitored regularly to prevent other possible medical conditions. So what is hypertension exactly? Hypertension is the term used to describe high blood pressure. Everyone needs pressure, and without it, blood couldn't travel through the whole entire body. With blood pressure, blood is able to move through the body, providing oxygen and nutrients to vital organs. Hypertension can be a risk factor for a variety of medical conditions as well, such as causing damage to the brain, the heart, arteries, and even to the kidneys. Hypertension can be, the more rigid your arteries are, the harder your heart pumps. The harder your heart pumps, more damage is done to the inner walls of the arteries. So what causes this hypertension? And there are many risk factors that contribute to hypertension. Too much salt in your diet can lead to hypertension. The condition of your kidneys, nervous system, or blood vessels, they're all risk factors contributing to hypertension. Even smoking, obesity, and diabetes are all risk factors as well. So how do you tell if you have hypertension? A healthcare provider can determine if hypertension exists, and it can be continually monitored at home using a blood pressure meter. A healthcare provider can perform a physical exam and can check a person's blood pressure to see if there's any possibility that hypertension may exist. Also, a blood pressure meter can be used at home to continue to check your blood pressure regularly. A blood pressure meter can be used at home, such as this one here. It's simply by placing your arm in the armband and starting it up, and then it will provide you the readings. When using a blood pressure meter such as that one, the blood pressure readings provide two different numbers, and they're measured in millimeters of mercury. The top number is the systolic pressure. This is the pressure inside the arteries when the heart beats. The bottom number is the diastolic pressure, and this is the pressure inside the arteries when the heart is at rest. Hypertension is considered to be present when a person's blood pressure is consistently at least 140 over 90. And the number 140 represents the systolic pressure, and the number 90 represents the diastolic pressure. Most of the time, someone with hypertension will not even experience any symptoms at all. And however, symptoms may occur and could be possible, a sign that someone might have hypertension. Such as severe headaches, chest pain, confusion, ear noise, ear buzzing, nosebleeds, or even tiredness. So now we know what hypertension is. It's a term that describes high blood pressure. And even though there are many risk factors that contribute to hypertension, it can be monitored regularly to prevent other possible medical conditions. So checking your own blood pressure at home can be a way to monitor any type of hypertension and potential for heart disease.